Finger joint pain. Understanding, managing, preventing arthritis. Don't ignore stiff, painful fingers. Early action makes all the difference. Our hands work tirelessly every day, making finger arthritis particularly disruptive. This comprehensive guide covers everything you need to know about arthritic finger pain, from identifying symptoms to effective management strategies. Understanding finger arthritis. Arthritis develops when joint cartilage breaks down, causing bones to rub painfully together. The fingers contain multiple vulnerable joints, making them prone to several arthritis types. 1. Osteoarthritis, most common type causes. Gradual cartilage wear in finger joints leads to stiffness, bony nodules, and reduced mobility. 2. Rheumatoid arthritis. Autoimmune condition attacking joint linings causes symmetrical swelling in both hands, may lead to finger deformities. If untreated. 3. Other variants. Psoriatic arthritis, combined joint and skin symptoms. Gout. Sudden, severe pain from uric acid crystals, post-traumatic, develops after hand injuries. Spotting the signs. Watch for these warning symptoms. Morning stiffness lasting over 30 minutes. Swollen. Tender finger joints, reduced grip strength, visible bumps, finger drifting. Misalignment early. Diagnosis leads to better outcomes. Consult a doctor if symptoms persist beyond 2 weeks. Effective management strategies. 1. Hand exercises, finger bends. Slowly curl and straighten each finger. Thumb touches. Reach thumb to each fingertip. Resistance training. Squeeze therapy, putty range of motion. Spread fingers wide. Then relax. 2. Pain relief therapies. Heat relaxes stiff joints. Cold reduces acute swelling. Massage improves circulation with gentle kneading. 3. Medical interventions, anti-inflammatory medications, corticosteroid injections, splinting for joint support, surgery for severe cases. Prevention tips: maintain healthy weight to reduce joint stress. Stay active with low-impact activities. Use ergonomic tools to minimize strain. Eat anti-inflammatory foods. Stay hydrated for joint lubrication. When to seek help. Pain interfering with daily tasks, sudden swelling or redness, noticeable finger deformities. Pro tip: keep a symptom diary to track patterns and triggers for your doctor. Myths versus facts. Cracking knuckles causes arthritis. Fish oil supplements may help, only elderly get arthritis. Remember, while arthritis can't be cured, proper management helps maintain hand function and quality of life. Start implementing these strategies today. Have questions? Share your experiences in the comments below.